The Behavioral Health Consortium plans to launch 3 leadership councils to improve services in the borderland. They'll be announced during an event tomorrow. The guest speaker will be Linda Rosenberg, President and CEO of the National Council for Behavioral Health. And joining us now are Linda Rosenberg and Enrique Mata, Senior Program Officer for the Paso del Norte Health Foundation. Thank you for joining us.
Thank you for having us.
So, essentially, you identified some gaps in services when it came to treating behavioral health in the borderland, you were saying.
Right. So the El Paso Behavioral Health Consortium came together to look at the future trends that we needed to prepare for. And through that, we did a behavioral health assessment of the community. That was done last year in 2014. And it identified gaps that we needed to address. And so now we are at a stage where we have some leadership councils that are going to move forward collaboratively through the community and see if we can't build some better coordination around our service systems.
And Linda, you arrived today from New York. Tell us what you're doing here.
Well, I'm here because I think it is a very important time. People are realizing that mental illnesses and addictions touch almost every family in some way, and people are talking about that and realizing that if people get the treatment they need, they can do well in school, they can do well at work, and they can stay out of the criminal justice system. And very often it means identifying problems when people go to see their primary care physician. And then taking action. And I think what they're doing, the kind of collaboration you see in El Paso, is really a model for cities around the country, where people are coming together to say, we've got problems, people aren't getting the services they need, and we're going to make sure they do. And by working together, we're more likely to be successful.
And the first step to that, I really think, is talking about it openly and really trying to get rid of this stigma around mental health.
Yes,
definitely.
I think certainly we're involved in that. Enrique has embraced a program called Mental Health First Aid, which really teaches people about mental illnesses, what the warning signs are, and what you can do, even for a friend or neighbor when they're in crisis. I think the next piece of work is helping people know they can get help and where they can go, and then helping parts of the system really to be responsive.
And so tell me, what these 3 councils, what will they do? What pragmatic steps will they take to try to make sure that El Pasoans get better service?
Well, we know that there's already existing groups out there working, and so we didn't want to reinvent the wheel. What we did was we looked to the leadership in the community and said, let's see where we can coordinate together and really build this. So there's a Justice Council, which is led by the El Paso County Sheriff, and this group is coming together to look at the justice system, and tremendous leadership there. But we're also working with groups like the Jail Diversion Committee that has been around for a good long time, more than 10 years. And those folks are really on the ground, real time, looking at cases. And so this group might be looking at organizational policy changes that will help impact the concerns that they're seeing in the real-time, day-to-day events. The Family Leadership Council is working around child and adolescent health, and then we've got a council looking at behavioral health integration into primary care, where we can see services where people need them and when they need them.
Okay. All right. Very interesting work. Thank you so much for joining us and explaining this to us. We appreciate it.
Thank you for having me.
Thank you. Of course. Thank you.
Thanks a lot.
Thank you, Enrique. All right. Moving on.